Colds are small infections in your nose and throat caused by over 200 different viruses. The most common one is called rhinovirus, causing 10 to 40% of colds. Other viruses like coronavirus and respiratory syncytial virus, RSV, also cause colds. Colds usually last around 1 week, but sometimes they can last longer, especially in kids, older people, and those who aren't very healthy. In the United States, more people go to the doctor for colds than for any other reason. Adults usually get 2 to 4 colds each year, mostly between September and May. Kids usually get 6 to 8 colds per year. Colds are easy to spread and are highly contagious. They usually spread when tiny droplets with the cold virus are passed from person to person through touch or by breathing them in. After a cold virus enters your body, it takes somewhere between 1 to 3 days for symptoms to show up. These symptoms can include a runny nose, congestion, sneezing, a weakened sense of taste and smell, a scratchy throat, and a cough. Sometimes it can be a bit confusing to figure out if you have a cold or the flu. Both have similar symptoms, but the flu tends to stick around longer and can be more intense. If you're dealing with the flu, it's not just a quick and mild illness like the common cold. The symptoms can last longer and you might feel worse overall. For little ones, especially babies and young kids, they are more likely to develop a fever compared to adults and teenagers when they have a cold or the flu. Here's an interesting fact. If you're a smoker, you might experience more severe symptoms than someone who doesn't smoke. Smoking can make the impact of a cold or the flu more intense on your body. So if you're feeling under the weather and wondering if it's a cold or the flu, keep an eye on how long your symptoms stick around and how intense they are. And if you're ever unsure or need advice, it's always a good idea to reach out to a healthcare professional. What to do if you get a cold? When you feel a cold starting, you can use over-the-counter medicines to help with the symptoms. These medicines can give you temporary relief. Some medicines like acetaminophen, aspirin, and ibuprofen can make asthma or peptic ulcers worse. If you have asthma, ask your doctor before taking these. Pregnant women should talk to their doctor before taking any medicine. Don't give aspirin to kids under 18, as it might cause a rare but serious condition called Reyes syndrome. Always talk to your doctor about which medicines are right for you. If you have congestion, a cough, or a runny nose, you can use a decongestant, antihistamine, or a mix of both. But if you have thyroid disease or high blood pressure, check with your doctor before using decongestants. Some cold medicines have both of these ingredients, so be sure to ask your doctor about the best choice for you. Always follow the instructions on the medicine labels and know what's in the medicine you're taking. Some medicines, both prescription and over-the-counter, have ingredients like acetaminophen, ibuprofen, or aspirin. It's crucial to read the labels to avoid taking too much accidentally. There are no medicines that can cure the common cold. Antibiotics don't work for colds. They're only for bacterial infections that might come after a cold. If you think you have a bacterial infection, talk to your doctor. Other ways to feel better. Some people talk about using herbs, minerals, and things like echinacea, eucalyptus, garlic, honey, lemon, menthol, zinc, and vitamin C to help with colds. But it's important to know that there's not enough scientific proof to say these things really work. Make sure you drink enough liquids. This helps to keep your nose and throat from getting too dry. When your mucus stays moist, it's easier to clear from your nose. Avoid drinks with caffeine like coffee, tea, and sodas. Also, stay away from drinks with alcohol. Caffeine and alcohol can make your body lose more water, and that's not good when you're trying to get better. If you smoke, try to stop or at least smoke less until you feel better. And if you're around other people who smoke, try to stay away. Breathing in their smoke can make your throat even more irritated and make you cough more. If you have to go to work or school, it won't slow down your recovery. But to help stop the spread of germs, use tissues and wash your hands often. This way, you can keep others from getting sick too. How to stop a cold before it starts. Try not to get too close to people who have a cold, especially in the first few days when they're most likely to spread the germs. After touching someone who's sick, touching something they touched, or after blowing your nose, make sure to wash your hands. If a kid has a cold, wash their toys after they play. Don't touch your nose and eyes too much. This can help you avoid getting the cold virus particles on your hands into your body. Put up a second towel in the bathroom for healthy people to use. This way, everyone can have their own towel. Keep an eye on how humid your surroundings are so that your sinuses don't get too dry. If you have a cold, cover your nose and mouth with a tissue when you cough or sneeze. Then throw the tissue away and wash your hands. Try not to be around people who might get really sick from a cold, like those with asthma or other lung problems. Colds usually go away on their own in a few days or weeks, even without medicine. But sometimes, a cold can open the door for other infections like sinus or ear infections. If you have asthma or other lung problems, your symptoms might stick around for a while even after the cold is gone. If your cold is really bad, if you have a high fever, ear pain, a bad headache, or if your cough gets worse, While the rest of your cold symptoms get better, it's a good idea to talk to a doctor. Thanks for tuning into our guide on the common cold. We hope you found these insights helpful in understanding, preventing, and managing those pesky sniffles. Remember, despite its inconvenience, the common cold is usually a temporary visitor. If you enjoyed this video or found it informative, give it a thumbs up. And don't forget to subscribe for more health-related content. Stay healthy, take care of yourselves, and we'll catch you in the next video. Until then, wishing you a sniffle-free day.